The first thing that there is to discuss when it comes to mental health challenges for older adults is what exactly are these challenges? In an article by Kang and Kim published in 2022, they mention how one of the biggest factors is ageism, and ageism is essentially prejudice or discrimination towards a person simply because of their age. Examples of this can include getting fired from the workplace because of your age, getting harassed in a public place or workplace, having explanations dumbed down for older people, an employer viewing workers as out of touch or less productive because of their age. Another factor that these researchers mention is how proud the people are of their age group, and this can be affected by many things such as self-esteem, support, environment. And two other researchers, Phillips and Morell, mention that practical challenges for older adults that can impact mental health include bereavement, economic and social loss, and new physical illnesses. So how exactly does this affect their mental health? In the same article I mentioned before by Kang and Kim, published in 2022, they focus on studying the psychological well-being of young adults. And their studies, as well as other studies that they reviewed, confirmed that there was a negative association between psychological well-being and ageism. They found that these things can lead to issues as severe as depression and anxiety. However, they also stated that individuals who are proud of their age group experienced less negative emotions, were more optimistic, and were more self-confident. In the article published by Phillips and Morell that I also mentioned earlier, they found that older adults were experiencing higher levels of unpleasant life events, which eventually caused them to perceive that they had a greater lack in the amount of social support available to them in their time of need, leading to mental health challenges and issues. So what can be done to help? Across many platforms, we see all the time the importance of encouraging help-seeking behaviors as well as increasing mental health literacy. In fact, in an article by Margaret and Casey where they sought to research how to help older adults be able to help themselves, they stated that mental health literacy was a significant factor in help-seeking behaviors among older adults. Those who were informed about mental health and the help available to them were more likely to seek help. They also believe that interventions to increase mental health literacy for their relatives can encourage help-seeking behaviors among older adults. So essentially, awareness is key, and increasing mental health literacy is a huge factor in how we can help older adults.